Big Med. Megaproviders and the High Cost of Healthcare in America. By David Dranove and Lawton R. Burns. Published by the University of Chicago Press. Preface. Economists and sociologists rarely see eye to eye. It is even rarer for them to team up and write a book. But it was clear from the beginning of this venture that the story of healthcare integration was too big to be viewed through a single disciplinary lens. Despite our different training and approaches to research, our partnership seemed inevitable. We have known each other for nearly 40 years, since we were junior faculty at the University of Chicago. By the time we received tenure in the early 1990s, we had moved on to our permanent homes at Northwestern University and the University of Pennsylvania. It was during this decade that we witnessed the first great wave of healthcare consolidation, with the emergence of integrated delivery systems. We independently conducted research on systems, bringing different perspectives to our work. Dranove, the economist, demonstrated the limited benefits of scale and scope and the potential dangers of rising market concentration, while Burns, the sociologist, documented the difficulties of managing large healthcare organizations and the special problem of integrating physicians. We shared our skeptical findings with students, alumni, practitioners, and the media, but our voices were drowned out by the chorus of supporters of integration. Events would soon bear us out. By the early 2000s, integration had failed to reduce spending or improve quality, but did enhance market power and lead to higher prices. Spending rapidly increased through the decade. Concerned about these trends, we did what academics always do: we engaged in more research. We continued to find evidence that systems were harming the health economy, and shared our conclusions with our academic colleagues. Nowadays, many academics are studying the same issues, and in many ways their work supersedes our efforts, even while reaching the same conclusions. We are beginning to have some real-world impact. Media outlets increasingly report on the high and rising prices charged by medical providers, and the two of us have been among a handful of academics to testify in hospital antitrust cases, where courts have blocked several problematic horizontal and vertical mergers. Yet systems continue to grow, and the current political debate about our healthcare system seems to avoid any discussion of them. This is a huge mistake. Large integrated hospital-based systems, we call them megaproviders, bear the greatest responsibility for the cost and quality of medical care, more than drug companies,
Sample complete. Ready to continue?